everybody. Peter Walsh here, St. Mark's Episcopal Church, with Mike Handler, the Emergency Management Director for the town of New Canaan. I want to begin with prayer. Let us pray. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous. And all for your love's sake. Amen. So, Mike, it was a week ago that you and I were sitting perfectly social distanced with the 6-foot table in between us. And now here we are a week later, and it seems as though a month has gone by. You have worked without ceasing. So many people in the town have worked without ceasing for the common good. Just a word about where we are now. I know we get that through your 7 p.m. phone call, but just a word about where we are now, and then a word about where you think we might be headed.
So thanks for having me back again. It's hard to believe it's only been a week.
Yeah.
There's been a lot that's happened in the last 7 days. I think most importantly, I think everybody in town is acutely aware of why we're doing what we're doing now. I think that has helped to the extent that early on in this process, people were questioning why they had to self-isolate and stop gathering. I think we've also had the unfortunate reality that this has touched our community directly,
Right.
And will continue to do so. So we've also made a lot of progress with testing, not just here, but nationwide. So I think that will bring us more data. Unfortunately, the data that we're seeing in the United States is not good data in terms of what we want to be seeing, but it's what we expect to be seeing. So we are seeing, in Connecticut, we've tested roughly 3,000 people, and we've got a little over 200 confirmed cases. Some of those test results we're still waiting on. Here in New Canaan, we've done 50 on Friday. We're still waiting for those test results to come back early this week.
Yep.
So I think we've seen Fairfield County hit especially hard. More than half of those cases are in Fairfield County. 4 of the 5 fatalities are in Fairfield County. And that's unfortunate, but that's what we're dealing with. So
Yes.
The message remains consistent. We must socially isolate. We must not gather. We have to continue to wash our hands and be mindful and make sure that we are doing everything we can, not just as adults, but to parent our children to keep them from spending time with their friends and loved ones, because those are the vectors that are increasing the spread of the virus through the community. So I think we have made that point clear, abundantly clear every single day. We'll continue to make it until we're out of the woods on this.
Yeah. Well, no doubt that the world, our local world, has gotten a greater sense of this, and also no doubt that the numbers that you're talking about, this is exponential growth. This is not geometric growth. This thing is, the numbers are headed straight up. I wonder if you might say a word about the timeline. You know, we had, you said last week, maybe personally or with everybody else, you don't like to move the goalposts on people, and yet we're talking about a pandemic and a spread that we cannot fully predict. And it seems as though the timeline, which Governor Cuomo had said last week was maybe 45 days, and now perhaps that's now moving into the summer. Do you have a sense of that you could help share with us?
So with respect to social isolation and the new normal for us to kind of keep to ourselves, that is very difficult to predict because there's a component that we have no control over. And that component is when we will have an effective vaccine and or antivirals that are proven effective. So I think we will be in this new normal until we get confirmed data that suggests that there is antivirals and a way to contain how this spreads throughout our community in a controlled fashion. Because again, this is not about keeping everyone from getting exposed. It's about keeping everyone from getting exposed at the exact same time, because we have limited resources in the hospitals. So I think we will be in kind of social isolation until we have a definitive answer on vaccines and antivirals.
We were talking about the timeline and the disruption in our lives, and so in not moving the goalposts and having some sensibilities on it. So we started at one point with 2 weeks, and you know, I believe that we all have implanted within us the school year. I mean, even doesn't matter your age, we all sort of work on the school calendar, and so now we are watching schools in the beginning of summer. And I not to be kooky here, but is it possible that our summers will be disrupted in such a way that summer camps and the normal, I'm going to go to our summer home or Granny's summer home, is that on the table also for our world?
So everything's on the table. So I don't want to declare today that this is going to last through the summer, but I can tell you that we are preparing for every eventuality. So we've looked at what it looks like we don't get back into public schools this school year, what it looks like it extends beyond that. Not that we are anticipating it's going to happen that way, but we're preparing for it. We're looking for long-term disruptions to supply chains for food, for prescription drugs, things like that.
Right.
We're looking at major focus of ours right now is on the surge going to hospitals. We have this responsibility in New Canaan to take care of 20,000 people, and we will. But as soon as we put them in an ambulance and drive them across the border to either Norwalk or Stanford, there's still our responsibility. And our goal right now is to make sure that downstream from New Canaan, we've got the resources, or they've got the resources they need to care for our citizens.
Yes. We in Fairfield County, we have so many cases and a great intensity of cases. We also have tremendous medical care in our community, and we're all very aware that our doctors and nurses and all the staffs need to be armed with the appropriate shields in order to continue to care for people.
Right, so what we're experiencing right now is a degradation of the threshold of what you can use and not use to be safe in a hospital. So because we lack the adequate supplies in our country, we are just reducing what the criteria is that you need to have. So we've gone from a technical N95 mask to a surgical mask is acceptable, not because we know it's acceptable, but because we don't have N95. So those are very typical changes that we're seeing in the healthcare world, which has very bad consequences because it puts our healthcare workers at risk.
Yeah.
And that's when we're going to need them the most. So we are in a crisis in terms of how we maintain our readiness, how our first responders and our hospital workers are protected. Rest assured, public, private, everyone's doing everything they can to fix that, but it's global. So the whole world's looking for the exact same equipment at the exact same time.
Right. Yes, I'm aware of that. It's really unique, really. It reminds me, just as we've heard about the War Act and Rosie the Riveter going to work to build the planes and sorts of things like that. Right. So, Mike, maybe on the lighter side, but maybe not. Toilet paper. Who would have guessed that the world would be obsessed with toilet paper? You got a word about toilet paper?
It's a good thing for people to focus on because it's kind of humorous. But the fact is, it's indicative of the supply chain issues that we're going to have. If our truck drivers are not, healthy, they can't deliver, and that's going to affect not just toilet paper, but things that we really need to survive. So, why people are stocking up on toilet paper, I don't necessarily understand, but I get it. And people want to protect themselves for the next 3 to 6 months, and that's not, it's not a bad way to think.
So let's have a word from the questions in the community.
All right, so some questions. I think a lot of people are experiencing this. They've got their adult children coming home from wherever they live or from college. How can we prepare quarantine quarters for a child that's coming home to wait out the situation? We assume they're contagious even though they have no symptoms.
So I think quarantining at home for someone who is under investigation really just involves staying in one room, preferably a room with their own bathroom, kind of leaving them alone as much as you possibly can. Hopefully they're not too sick or they don't exhibit symptoms. If they do, we can leave whatever you need to provide for them at the door, let them take it in and do it themselves. If it's beyond that and they need direct care, then you would need masks and stuff to protect yourself. It's not easy. It's not easy having a child in your house that you can't spend time with when they're not feeling well. We all want to be with our kids when they're not feeling well, but this is a little bit different. And the important thing is to get them tested. If they actually do exhibit symptoms, call your private physician, or you can go online and get tested through New Canaan, but you need to get them tested so we know kind of what we're dealing with.
Yeah.
And the important thing also is if they're not feeling well, you should also be staying in it as well. So if there's symptoms of someone in the house that has not been tested, you assume that they have it, and you want to be staying in the house and keep everybody that's been in direct contact isolated as well.
Thank you for that last piece. Yeah, very helpful. And as you know, many of the people in our community have their adult children coming home because their jobs in New York City or their jobs in Iowa are now working away from the office, and so we have households reconvening in ways that perhaps they haven't convened in a long time. And I know that many adults are concerned about not just little kids, but the big kids who come home.
So, I'm not sure you're going to know the answer to this, but I'm interested in your opinion. Do we anticipate that interstate roads will be closed at some point to non-essential travelers?
So it should be anticipated that we will go into a greater restrictions over the next week to 10 days. I'm quite frankly surprised it hasn't already happened, but we're going to get there. And whether or not that means you can't drive interstate remains to be seen, because it's very difficult to stop that. I think what it means is it's telling people to stay independent, stay at home, do not go to work, unless it's absolutely essential. We're trying to define what essential means these days.
Right.
It's kind of, custodians have to get to an apartment building. You can't have 500 people living in an apartment building without having custodial services. Does that become an essential service? So we're all kind of redefining that as we go. But the message should be the same. Hopefully it's been consistent in New Canaan. Stay home.
Okay.
Let me just say, we're on the question of interstate travel here, and you were saying that we're looking toward a time where they would like to have some restrictions. Whether or not they can figure that out is still up in the air. And I wonder if you might also comment on air travel, airlines and moving around the country by flight.
So I think the easiest thing would have been to shut down all air travel and shut down all mass transit. But obviously there's a reason why we're not doing that. We're not doing that because essential workers, grocery store workers, restaurant workers, whatever we need to keep the food chain and supply chains moving have to get to where they need to go. I think what's keeping them from stopping mass transit now is really that no one's riding mass transit. So there's really very few people on the trains, which is the way it should be. So maybe that's why they're keeping them running. Look at New Canaan. Let's take it to a local level. We are mindful that people need to be doing things. They can't be stuck in their house all day long, so we encourage people to be in their yards, playing with their families, among their own family. The fields are a difficult thing for us, school fields and town fields. So we didn't close them because you can't really close a field because you have to fence the entire thing in, which is very difficult to do, but we put signs up, we put announcements out, but people are still using the fields. So just the practicality of closing something is very difficult, much like the highways and the roads. So we again ask people not to congregate on the fields, no organized sports. We don't want to see another organized baseball game at Mead Park. It looks great, it's nice to see, but it can't have it right now. So if we do see that behavior continue tonight we will close all the fields. And how we enforce that remains to be seen. But I think the state and the federal government go through the exact same exercise right now with roads. You can close them, but how do you actually enforce it?
Right. Yeah. I know that people in our own parish are asking me questions about long drives, or maybe they've been in Florida. They have elders that put them on an airplane. When would that come, or when would that not come? But I understand that really the recommendation is get where you're going to be and be there. Is that a good way of saying that?
Let me clarify that. You should already be where you're going to be. So if you have people that are in Florida, elders that need to get up here, I would not be flying them on a plane.
Yeah.
I would not. It's certainly that age category or anyone medically fragile, I would keep them exactly where they are. They're safest where they are. I've had friends that have asked, should we go to a certain state that's got fewer cases because the hospitals won't be overrun? And the fact of the matter is, this is going to touch every community. All counties in Fairfield, in Connecticut, have been touched.
Yep.
Fairfield the greatest, but all counties have cases confirmed. So I don't think this is going to be where someone's going to be spared. We're going to have certainly heavier pockets in certain areas, but wherever you are today is where you should remain.
Okay, great. Jill?
Okay, questions, and you touched on this a little bit with the fields about appropriate use of open space. It sounds like in general you're saying that it's good to be outside to maintain appropriate distancing and don't gather in open spaces. What about in particular older people who are worried about this?
So again, the message needs to be very clear. If you're over, and the data is changing, right? So we used to say this is only affecting the older population or those that have pre-existing conditions, but that's not entirely accurate anymore. The data is also suggesting that 20 to 45 years of age is still having an issue here. So certainly the vast majority of the poor outcomes are skewed towards the older, but if you're over the age of 60, my recommendation would be that you stay home. If you're going to go for a walk or get outside, be in your yard. You can walk, but I would not be out grocery shopping. New Canaan's done a remarkable thing through Health and Human Services and a lot of support from public and private nonprofits. We are getting volunteers to actually do the shopping for the several thousand seniors that we have in town. And the idea there is, you can start by having the grocery stores restrict hours for seniors to shop only, but that is exactly the opposite of what we want to be doing. We don't want to pull seniors out of their homes into the stores. We want to keep them home. So what we're doing is one step beyond that, and it's not easily done, but we've got remarkable volunteers and support. We're going to assign seniors in town a shopper. And that shopper is going to have unique hours to pick up the food that they need to get from the grocery stores and deliver to the front doorstep and leave, and no interaction. So that's kind of the message is, if you're in that age category that has a poor prognosis if you get sick, we don't want you going out at all.
Yeah. So, Mike, you are part of something put together by the government in the town here. I just let everybody know about it. It's an incredible operation, a daily Zoom conference where you have the governmental leaders, you have nonprofit leaders, and you have leaders from some of the essential businesses of the community coming together in a communal conversation. And part of the mobilization of that, I just want to share with people, because it is beautiful and extraordinary that you get government and private businesses like Stewart's, Alex Stewart, amazing guy, and then you get the nonprofits like the churches and the religious institution of the community. Everybody getting volunteers to do the shopping in the place where Alex leaves it open so that it can be delivered, and the coordination of this through Health and Human Services. It is one of the, in the worst of times, one of the best of times of anything I've seen since I've been in New Canaan.
Yeah, and I think I mentioned to you earlier before we went on air that that doesn't surprise me. That's why we live here, right? That's why this is a very special community. What does surprise me is we're doing it all virtually. Like normally, at least my team and the town's employees all come together, and we're very good at working. And what's challenging for me, and I think we're all having to adjust, is I can generally look in a room full of people that I've spent 20 years working with,
right,
and look at an expression on my face and know something's actually wrong. We don't have that luxury now. So now we're finding different ways of communicating. And listen, it's not easy, but it's doable. And I think society is realizing that we're going to change the way we do business entirely. So the generosity and the ability for everyone to come together doesn't really surprise me. It's always refreshing to see, but it doesn't really surprise me. And I think those calls are kind of interesting because we've got a lot of calls where we identify the challenges, and it's that community call where we actually come up with the solutions. Yeah. And I can't tell you that call ends, and I try to be on every single one of them, but it's kind of tough because we've got a lot of things pulling in the same direction. But
sure.
When that call ends, then the phones start ringing, and people say, all right, I heard you had a need for this, how about this? And no suggestion is a bad suggestion in a pandemic. That's what I've learned. And that being said, money isn't the solution to all problems. So we've got to get very creative, very, very creative in how we address some of the challenges that we face.
Yeah, okay, thank you for that. Jill?
Okay, here's another one. People, in the vein of people wanting to help each other, many in the community have asked about ways they can help out our EMT volunteers, hospital staff, healthcare staff at Waveney, first responders, police, fire. Are food donations from local restaurants acceptable?
So let's start with the first question, how you can help us, help the first responders take care of the community. This is going to sound crazy, but the easiest thing you can do to help first responders is to follow our advice and socially isolate. We're getting overrun with calls as well. We're lacking the same personal protective equipment that everyone else is lacking.
Yep.
So to the extent that we can actually manage our care and self-isolation at home, only rely on EMS when it's absolutely necessary, that helps. This is not the typical event where you can deliver food by the truckload to EMS headquarters because they're working around the clock, which they are, but we just can't have that kind of contact now. So the traditional means of support are different. If and when the opportunity arises for people to actually donate time and resources, we will certainly let people know.
Yeah.
Okay. This is a question about, in the vein of essential work, is the town comfortable having, construction workers working closely together at various sites when, for instance, in school buildings where everybody's been sent home, but this kind of work might go on?
Good question.
Yes, so the notion of social isolation is not to keep everybody from getting exposed. Okay, it's not that we're going to stop you or I from getting exposed to this virus. We're going to get exposed. The notion is to slow it down so that we're not all getting exposed at the exact same time. So I'm not suggesting that it doesn't trouble me when I see 12 kids playing, a pickup basketball game in the park. It does. Because that, while it's nice to see them outside entertaining themselves, is not essential work. There is still some work that needs to get done, and we're not telling people they can't work. If you have road crews doing, pipe breaks, they're going to have to go out and fix that pipe. Some of that stuff has to continue. So is construction necessary? Not necessarily, but, if you think about it, you can't do a lot of this work when schools are occupied. So if there's abatement work that has to be done in a school, you just can't do it when it's occupied. So if you don't take advantage of doing it while the school's unoccupied, you may not be able to get to do it. So what we're telling construction is everyone's making their own decisions as to what is essential, what's not essential. But be smart about it and use precautions. You don't have to be on top of each other. You can wear a mask, you can wear gloves, you can wash your hands. There are things you can do to still be safe, but doing essential work. And that's kind of how we've left it with construction.
And I guess a second part of that question would be, to the extent that essential work that continues to create jobs and money flowing in the economy is a secondary concern, but is something, right? So I had another question. If there's a complete shutdown of travel and movement, isn't that creating more stress on our economy than the virus is to our health?
I don't agree with that statement. This is not a financial crisis. The symptom is financial, but the crisis is a health crisis right now. And I think the toothpaste is out of the tube with respect to the impact on the economy. There's certainly degrees of bad when it comes to economic turmoil, but right now, if we don't address the health crisis, it's only going to prolong the downturn in the economy. So whatever impact we have and are going to have, that's just a reality of what we're dealing with. And it's not something that New Canaan is going to solve, or the state of Connecticut. This is a global issue we've got to resolve, and it's something that the federal government's got to take issues with. This is not an issue that money can solve. I understand people have to pay their bills. I understand, if you don't pay your rent, the landlord can't make the mortgage payment. I understand there's an impact up and down the socioeconomic cycle. The issue is this is a health crisis. So everything must be done at all costs to stop what we see coming in the next 3 to 6 weeks, which is a run on our hospitals where we have to make really dire decisions as to who gets care and who doesn't. That's all we're focusing on right now. And I can tell you, my responsibility in town as the emergency management director is not to look out for the global economy and not to look out for the New Canaan economy, even though we are mindful of it and we do focus on when we do something, it has an impact and a reaction that we might not want. But our job is to keep people safe and protect property. And there's no doubt in my mind, you could open up restaurants for social gathering in restaurant dining. We could do it tomorrow, and those restaurants would be back in business and doing okay. We'd be causing people their lives, and that's why we're not doing it.
Yeah. So just that last thing you said about these policies are going to cost people their lives, first of all, is worthy of our pause. I also want to have a shout out. I know from our town Zoom calls, and I know from your 7 o'clock, hi, this is Mike Handler, calls, that you are encouraging street side pickup so that the local restaurants can drop you a bag of grub. And you're trying to keep those businesses in business for all the good that brings.
Yeah, so people think that we're trying to keep restaurants open because we like the restaurants. But of course, there are local businesses, we want to support them. That's not what this is about. This is about keeping a very viable food chain and supply chain available. And if the restaurants can't sustain curbside delivery, then it's all going to fall on the Acme's and Walter Stewart's of the community. And that supply chain is already strained to begin with. So our job is to keep supply chains open at whatever cost we can, to the extent we're able to. And at some point, I expect those supply chains are going to close, either because they're losing too much money and they can't afford to do it, or because they can't get their deliveries. At some point, that's going to happen. So to keep them open as long as we can, we'll be better off for it.
Interesting.
And in that same vein, some people have asked, isn't it safer to prepare food yourself than to have it prepared by someone who maybe you trust but don't totally know what they've been doing?
Sure. So the Department of Health is ensuring regularly that restaurants are adhering to very strict protocols in terms of safety. So yes, doing everything yourself is always, you have control over it. But it's the supply chain that matters. If we were all forced, because every restaurant closed in Fairfield County, we would not be able to support ourselves with just the grocery stores. And it's not unlikely to think that just because the restaurants lose their supply chain, that the grocery stores will also lose their supply chain. Some have the same truck drivers, same suppliers, and it becomes an issue. So again, the goal is to keep critical essential items like food flowing for as long as we possibly can in as safe a manner as possible.
Yeah. Oh, wow. Just like war, those who study war talk about supply chains, and this is just like war and supply chains. Yeah.
Sorry, I'm just trying to see if I can consolidate some of these.
I have. Go
ahead.
Prescription drugs.
Yeah.
So critical essential supplies, prescriptions from pharmacies. I personally would much prefer seeing seniors, those with medically fragile conditions, buying a 3-month supply online and having it delivered to their home versus standing in line at a pharmacy. So while we had the pharmacies open and operating safely, I still don't think that's a good enough reason to get out of your house and go stand in line to pick up your prescription drug. So to the extent you're able to buy them online in 3-month supply, you should already be doing that.
Great.
And are there also possibilities of sending other individuals to pharmacies to pick up your prescriptions? I know obviously it's not groceries.
Yeah, we've talked about that. There are a lot of benefits to doing that, and there are also a good number of risks to doing that. So we're not there yet, and I think as long as we can get our prescription drugs delivered to the house, not by volunteers, but by mail order pharmacies, we should go that route. We'll have to find a safe way to deliver pharmaceuticals if it comes to that, but I don't love the idea of having volunteers pick up medications for obvious reasons.
So yesterday, Governor Cuomo said that we really won't know what we have going on until we can test everyone who wants a test, not just people who are symptomatic. Do you expect that ever to be a possibility?
Yeah, they're working on rapid testing right now. So there's been some positive feedback from a couple of companies that think they've got a 45-minute rapid test. That's what we need. Right now, the PCR testing that we're doing is really only effective with people that have a significant viral load, so they exhibit symptoms. But that is not indicative of what we have in the community. So the reason for testing the entire community is so we can see where the hotspots are and really quarantine those areas off. But again, I think we have to operate under the assumption this is community spread throughout our community. Yep. We're all going to get it. The best we can do is, and again, when I was here last time, we showed a graph. We're doing everything we can in New Canaan, certainly, to spread out the daily increases of cases. What we're also doing at the same time is trying to raise that line of what the hospital capacities can be. And that's kind of, we're going to need both measures working together to actually achieve success.
Yes, and thank you for that. I just want to circle back to a thing that was just part of the paragraph that you just spoke. We're all going to get it. I wonder if you might comment on that phrase, that sentence, we're all going to get it.
So we are. It's much like the flu, right? So we're all going to be exposed to it one way or another, whether it's through community spread or through a vaccine. We're all going to develop antibodies against COVID-19. This is not about preventing you or I from getting it. It's just you, me, and the other 19,990 people in town can get it exactly the same time. Yeah. Because if we do, we know a significant portion of the population is going to have a bad outcome, 5% roughly on a nationwide basis. We'll all seek medical care at the same time, and the hospitals cannot handle that. Yeah.
Yeah. Yeah. And I understand we have somebody in our parish, a wonderful couple whose daughter is in London. She has it now and is in, today is day 6 for her, and I understand, I'm not a doctor, I don't play one on TV, but that this might be a 7 to 8 day sort of tour of duty for people who get it.
I also am not a doctor, but we're seeing kind of 0 to 14 days incubation for most cases. There have been evidence that I've read where it's beyond 14 days, which is concerning. But most people develop symptoms in the 5 to 7 day range is what we're reading. So, she's in the middle of it. That's kind of right there.
So speaking of the things that, I know you're not a doctor, but you are listening to all the official agencies. 2 questions. One, the question of whether people who are asymptomatic can be shedding the virus. And 2, is there sufficient data now to even understand immunity after having had the virus?
So last question first. There has been evidence of people developing illness from the virus a second time. So just because you have it once doesn't mean you're immune from getting it again. The first question, there's still much debate whether this is droplet borne versus airborne only. We're operating as if it's droplet borne, but it's transmitted through droplets, but there's a very good possibility this is also transmitted airborne. And there's also some supporting evidence to suggest that this can be transmitted while you're asymptomatic, which is why the kids are the most critical vectors that we've got to focus on, because they seem to be having less of an issue with developing symptoms, but they are able to spread it very easily. So yes, the answer is asymptomatic spread is why we're in this predicament. If everyone that got sick was the only way you spread it, we would know how to quarantine people. It'd be very easy, but we don't have that luxury right now.
Yeah.
So how long a supply of food and other household supplies do you recommend that people have?
So I have a family of 7, and you can't have enough food in our house. We couldn't store enough to last 2 weeks if we tried. So I think whatever is manageable in your home, certainly you've got to get creative about what you're going to cook and how you're going to do it, and we've been trying to do that at home. But a couple of weeks' supply is not the wrong thing. I wouldn't go out and buy it all at once, but I would just buy a little bit more each day so you can kind of stock it up at home. And our hope is to maintain the supply chain throughout this entire endeavor. It's not possible that we know for sure if we can or can't, but our hope is to, at all costs, keep the supply chains going for food.
So here's another test. I don't know if you'll know the answer. Is it anticipated that there'll be a way to test sort of after the fact to see if you had it at one time and have come out the other side and the antibody's still present?
Yeah, I don't know. Certainly there's ways to test for antibodies for others. I'm not sure if we're close to being able to do that here. Perhaps we are. I don't know the answer to that.
Okay. What about visiting confirmed positive cases in the hospital?
There will be no visiting confirmed positive cases in the hospital.
If I wanted someone to come in and industrially clean my house, if I stay out of the house while they're doing that, is that something I ought to think about doing? Especially if I'm an older adult.
So I don't know what industrial cleaning means. I think the best we can do is hard surface cleaning, so hard floors, frequently touched, doorknobs, phones, those kind of things you can do yourself. I think we're doing industrial cleaning in commercial buildings. I don't know what the efficacy of industrial cleaning means. There's no real threshold and standard for industrial cleaning. My suggestion would be if you're home, stay home. There'll be plenty of time to figure out how to clean your house at some point. But right now, I would not be bringing people into your house to clean your house.
So just stay here for a second. We might end up with the cleanest houses in our neighborhood than they've ever been here. Could be the death of dust bunnies here. But I wonder if you could just say, what do you mean by cleaning, surface cleaning? Disinfecting, or what is that? And how does, are there disinfectants out there, speaking of supply chains? Or how does somebody actually clean the hard surfaces in their house?
So the guidance that we received is that hand sanitizers for hands need to have 60% or greater alcohol content to be effective. There's evidence that bleach kills on contact the virus, but also that it needs to be wet for 3 minutes. So I don't know where we fall into that category. So again, hard surface cleaner, Clorox wipes, I don't want to be touting brands and stuff, but bleach usually is what we use in public safety to clean just about anything. The right diluted bleach solution cleaning all hard surfaces is as good as you're going to be able to do. That's what we're doing in hospitals, that's what we're doing in the ambulances, that's pretty much the standard.
For someone, though, who's older and maybe just not physically capable of doing that in their own home, it's just not a physical possibility, is it better for them to have someone come in and clean rather than no?
So again, just my personal opinion, I could talk to our health director, Jen. I think if you're in the risk category of either over the age of 60 and every time I come back here, it's going to be ratcheted down 5 years. It was 65 last time I was here, I think. But anyone over the age of 60 or pre-existing medical conditions is probably best served not having anybody come into their home and leaving it the way it is, doing the best they can for now. I think the risk of bringing someone into your home outweighs the benefit of having them clean.
Okay.
How will the new regulations from Governor Lamont starting Monday at 8 p.m. impact things, and what will be the necessary changes that we at home need to take?
So my hope is that that has no impact on New Canaan, because we've already been doing that, which he's going to order at 8 p.m. So I really hope people have been staying home. I think the evidence that we've seen is, the roads are pretty quiet. People are not on the train, so people have either decided to work from home or take, leave, or unfortunately some probably have lost their jobs, whatever it is. Whatever the source of why you're staying home, stay home. And I think that's kind of what the governor's recommendation is going to be and what it has been. So long story short, it should not impact New Canaan any differently after that's imposed, because we've been doing it now for some time.
Yay for New Canaan. And along the, you mentioned about people who aren't working, so some restaurant chains and groups in town have started seeking donations to help to pay their employees because they're tipped employees. There's nobody to tip them.
Yeah, it's, again, we're not going to solve that problem easily. I know that there are a lot of foundations and a lot of not-for-profits that are looking for ways to raise money, and some have already been successful at raising money for just that purpose, to ensure that our long-term valued employees that, through no fault of their own, are now out of work, can't afford to pay their rent or feed their families, have some support. So I think there's going to be some support from the federal government, some from the state government, and certainly locally we'll take care of them as best we can.
Do you think that things like real estate showings of houses and things like that, I mean, that's a tough thing right now, that's going to be stopped as a result of the governor's?
My understanding is that's already stopped. So I think people have gotten very creative about virtual showings. So I think there's been a lot of drone work. There's been a lot of video work. Just about all the realtors that I know have gone to virtual showings, which they should. There should be no people coming in and looking at homes. It's tough, but now's not the time to be showing homes to multiple families.
I think I've actually asked you all the questions that have come in.
Can I ask you guys a question?
Yes.
Share with me kind of what the impact on your community here is like and what we can do differently to help.
Thank you. Like you, we as a smaller community, the members of our church have mobilizing anew. We feel that we have many. We feel like we're really, in some sense, built for this. We're a spiritual community that lives in the real world. The bonds of affection and community are tight. So we're doing something called Passing the Peace, which is we're laying out a phone chain of sorts to make sure that all the members in our community are touched and nobody is isolated in their social isolation. We are moving to a digital format in a very big way. This is being streamed and it's in YouTube form on our YouTube page. And our church service, where 2 or 3 are gathered together, we have 4 gathered together and we stream our services at 10 o'clock. I would say that we, like the town, like you were describing the town government, we know each other and the staff very well, but now we're learning what our houses all look like because behind us we're seeing that. I would say that the community has the worst of times and the best of times to the best it can, is really, really rising to the challenge. And yet we have mourning. As you know, Bill Pike, one of our beloved members, died of COVID-19. And also I received an email very, very early this morning that another one of our beloved members, and this comes an announcement to the people of God here, the St. Mark's people who are listening to us, that Joe Emlinger died last night. And we knew Joe was going to die, and he did not die of COVID-19. But now we have to learn we need to learn how to mourn our dead when we cannot gather face to face, because we're not going to gather and have funerals until we can gather face to face. So I would say that overall the church community is really just going for it, and I'm very energized and proud of them. Proud's not quite the right word, but I would also hasten to add that the other religious communities of New Canaan are the same thing. That religious communities to a great degree, and that's Jewish and Christian. We do not have a Muslim community in the town of New Canaan. They're all rising to be the people of God. So it is weird, but in certain ways, it's good.
Good.
Yeah. Jill, do you have a word on that?
I would just say that it's heartening to see the extraordinary amount of creativity that's been engendered by need among people to accomplish all sorts of things. And although you do sometimes encounter people who say, why should I inconvenience myself? I won't get sick. For the most part, the response from the people is, what can I do to protect other people? And to help them. And so that is really heartening at a time when I think everybody's looking for some good news.
Yeah. I mean, I must say, I moved here 11 years ago. It never occurred to me that a town like New Canaan could be so good, and I've never seen a community that had more volunteers. And in our case, I never had been a part of a church community that was so loving. And so, I'm bullish on this. I'm bullish on us.
As am I.
Even as we look at the face, into the enemy, into the virus, which is daunting. But I'm bullish that we as a community and we as a parish can do the right thing in the face of the drama.
I haven't really had the chance to think beyond what this looks like after this is over, but I imagine the next big snowstorm or power outage we have is going to be just a mere inconvenience relative to what we're going through now.
Yeah.
So I wonder how, hopefully people do remember that those were just inconveniences.
Yeah. Well, we look forward to a time when the only thing we have is a hi, this is Mike Handler. It's 7 p.m. and the power lines are down for these neighborhoods. What a great thing that will be when it's
you
just
and me
power
both.
lines being down. So I want to finish up here, Mike, and just to say again that I speak for our community, say we are grateful for you. You have no days off. You don't have hours off. I think you probably see your wife and children in passing. To say again that you do bear an incredible burden upon those shoulders of yours, but you do bear it in a community of leadership. First Selectman Kevin Moynihan, Jen Eilson. I mean, the whole team that you have is such an impressive crew, and we as the community are grateful to you. I don't know how, you don't have a reverse phone call where we can all say thank you, but for the community, I want to say thank you to you and to the First Selectman and to the team that you have, because we really get that you are serving the common good and serving us, and that extends all the way to EMS and all the way to the fire department and the police and everybody. It's really, God-given gratitude for you guys and gals.
On behalf of all of us, you're welcome and thank you for the support. What's kind of interesting about our team is there hasn't been anything, and I've said this before in prior years, there hasn't been anything that we've been facing that we couldn't overcome ourselves. And that's a pretty remarkable thing to be able to say for a community of 20,000 to be pretty self-sufficient. This might test that to the extreme, but there's nothing that we have asked of our team they have not been able to produce.
Yeah.
And without any pushback, they're just all ready to go. So, and
Beautiful.
they all have their families they got to take care of as well. So it's a lot. But Jen and I say it all the time, as does Kevin, there's no better team I'd rather be with right now. Yeah,
beautiful. Well, our prayers are the cover of the New York Post last week was praying hands and surgical gloves with a rosary, and it said, "Heaven help us." And so we're also in the business of Heaven help us, and our prayers are for you, for those teams, for the Waveney Life Care Network and Russ Barksdale, and caring for the elders of our community. We're all in this together, and we really are thankful that you came here at 9 o'clock to speak with us for 45 minutes instead of being on your phone at home dealing with some other emergency management situation. So thanks, everybody, for tuning in this morning. Thank you, Jill. Thanks for the folks who put on the stream for us. And Mike, thank you to you.
Thank you.
Peace be with you. God bless you.